Hi everyone, I'm Brett Beckman. I'm a veterinary dentist, and I'm happy to have you along for this 8-part webinar series on feline dentistry. Portions of this webinar were recorded in the studio. The majority was recorded at our feline dentistry seminar live at our new teaching center at the Institute of Technical Arts north of Orlando, Florida. You can view this webinar whenever you want, wherever you want, and as many times as you want on any device. Welcome to feline dentistry. When we think about feline dentistry, there are basically 4 disease entities that we think about initially, 2 of which are represented with this image and the following radiograph. And if you're looking at that image, it's very difficult to make any determination that there's anything bad going on there. And looking at that, you have to also take into consideration this is a computer image that's taken with a macro lens on a nice camera. So the detail in that image is much, much greater than what it would be if you were actually looking at the patient. So you have this patient on the exam table, you look at that patient, you're really not going to see a lot of subtleties there. If you look really closely right here at the distal aspect of that distal root, and right here, you'll see there's a little bit of inflammation and there's a little bit of gingival recession there. Now, radiographically, there's a little bit of a different story. You can see here where we've definitely got a defect. And if you look at the crown, we've got a decrease in density right here at that distal aspect, right above that defect. So these, in this one image and this one x-ray, demonstrate 2 of the 4 biggest disease conditions that we see, and this is probably 95% of what we see in cats as far as pathology goes, one of which, the bone defect being periodontal disease, and the other with the tooth changes, the decrease in density in that crown, tooth resorption. So those are two of the 4, and those are by far and away the biggest category of pathology that we see. And consequently, therapy for those involves extraction in almost all cases. There are some exceptions with periodontal disease, but we'll talk about those as we progress. The other category, stomatitis, and then the 4th category is squamous cell carcinoma. So when you think about feline dentistry, you think about those 4 things, and then there's all the rest. And the rest is probably things that you'll see in practice, but not real frequently. So we're going to concentrate on these 4 things mainly.